Welcome back. You tuned into Mid-Morning Talk, and I have joining me the president of the South African Pediatric Association, Professor Mignon McCulloch, and she's the head of the clinical unit, renal and organ transplantation pediatrics, based at the Red Cross Children's Hospital. And we're going to be discussing COVID-19 and children. Good morning, Professor, and welcome to Solar Media.
Morning. I'm hoping that you can hear me okay.
Yes, we can hear you loud and clear, and thank you for your time and for joining us. So, Professor, I think parents are now becoming nervous and concerned because with the first two outbreaks, children were relatively unaffected. In fact, the concern was they carriers to parents or grandparents and extended family. But I, as a childhood development specialist, I run an early childhood development program, and I've personally seen, just 5 minutes ago, I just received a notification again of a third 4-year-old that has tested positive, and the other two had severe fever, vomiting, diarrhea as well. So parents are now understandably nervous and concerned. So has this something to do with the Delta strain that mutated that is affecting children? Well, this is 4 years old. I don't know what your research is telling you, the youngest that has been tested positive.
Yeah, thank you. So thank you for having me on your show. And I'm going to take a step backwards and say I really understand parents' panic. I think after the discussion we had with our president last night, where we heard about this Delta wave, I think there's a feeling of panic and anxiety in everybody in the country as we wake up this morning. The good news, if you can call it good news, is that we know previously that this has been a disease that actually affects mainly older people, and it causes severe illness in older people. We've done some local research now. There's a good study out of Klerksdorp by the National Institute of Communicable Diseases that show that even if children do get it, they definitely spread it less than adults do. And so we're not saying that children can't get it, but children will get a mild form of it and will not normally need hospitalization. If we're worried about spreading or super spreaders, it's actually the adults ourselves that are spreading it to each other. And if you look at people's behavior, and that's why the president has closed down restaurants and bars and coffee shops, because as adults, we tend to take down our masks and spread it to each other. So there is this continual anxiety that to blame it always on the children. But in the last 2 waves, out of the 60,000 adults who died, there were only 400 children, it sounds like a lot, but it's a very small percentage. And all those children had underlying conditions like being premature babies or having cancer or having some illnesses from which they were going to die anyway. So children may get this as an infection, and we've seen quite a lot of children who've come in with road traffic accidents or injuries, broken their arms, and then incidentally they have been positive as well. So we're not saying that children cannot get it. We're saying they can get it, but they will usually have a milder form of this disease compared to the adults and to the grandparents. And in fact, it's the adults that are actually spreading this condition to the children. And so that's why we are saying, as adults, even at home, if you're feeling sick, please wear a mask around your children, because it's actually the adults that are spreading it to the children. And that's why we were quite disappointed that the schools are closed, because at least at school you are in a controlled environment where all the children are wearing masks at the high school age. Primary school, we know they very rarely spread it to each other. It's mainly the adults who are spreading it. And at least if you're in a school environment, you're not running around the community and spreading it in that way. So yes, this is a much more contagious version, this Delta wave, or Delta virus, but it still mainly affects older people and people with comorbidities. And that's why we are very anxious that all the older people are vaccinated. We are very delighted that the 50 to 60-year-olds are now going to be able to register for vaccination. And as somebody said to me this morning, isn't it crazy that the USA and Europe has got their acts together and South Africa has not. And I'm going to say the reason they've got their acts together is because they have all accepted the vaccine. And so, from our point of view, we really need to try and get as many people vaccinated as possible so that we can also get on top of this virus, because otherwise, I can't really see another way other than just continual waves of this infection, making everybody sick. But the children, we are not seeing. Yesterday, there was not a single child in our hospital with COVID, whereas the adult hospitals are absolutely full. So I think for anxious parents, we're not saying they don't get it, but we're saying they don't get it as severely as the parents do. And so if the parents are anxious, they need to be anxious for themselves, and they need to make sure that they practice precautions and get themselves vaccinated if they fall in the right age group. We're also delighted that the teachers are getting their vaccines as well.
Professor, you spoke about primary school children. Let's move now a little lower to pre-primary school children and those in early childhood development centers. In your professional opinion, is it better for children who are at early child development centers? And I mean, there are many parents that have to work. They don't have the luxury to work from home. So is it better for those children then to be at those centers because precautions would be taken there than having somebody at home just overseeing the children there? And also at your grade double note and grade note, for them, what is your opinion in terms of them being at an educational institution?
So, in the first wave, we didn't have any South African statistics. And after the second wave, we've now been able to gather statistics. So people older than the age of 25 definitely get it. The 15 to 25-year-olds will get it more than the 5 to 10-year-olds, and the 0 to 5-year-olds are the least at risk of getting it. So we know that if you're a teenager over the age of 15, your chance is more of behaving like an adult in terms of getting it. But the children under the age of 15, and that includes primary school and early childhood development, are less likely to get it. We're not saying they won't get it, but we're saying if they do get it, the disease will be far less severe. This is an adult disease. And so whatever mechanism you can use to try and stop overcrowding, stop spread, especially if kids are sick, is to either in a school institution or with the school holidays, at home, preferably outside if it's not raining, but also to be very honest and say, if you have got a sick child or a sick adult, don't mix with the community, because the physical structures in place of face masks, hand sanitizing and social distancing is what's going to stop this virus from spreading. It's aerosolized. So we breathe it out, we cough onto people. And when I walk in the streets, I am absolutely dismayed by how many people will wear a mask over their mouth, but completely forget that they breathe out of their noses. So important to wear a mask properly if you're an adult. We've said that children under 5 or 6 realistically can't wear masks. But if adults are wearing masks, then children may be a copycat and they may actually follow the lead of their parents for a short while. But at the end of the day, the kids are not the super spreaders. And we need to just continue to remind the adults that they are the ones that potentially are spreading this virus.
And I know that the South African Medical Research Council have been conducting research in various fields and collating research as well, specifically on COVID-19 in children. I believe there's also a registry been set up in terms of children who have been hospitalized for COVID, and that what are some of the results that have come out from those studies? I know there's an international study as well with some other countries, Ethiopia, India, Pakistan, and South Africa as well, to understand the clinical characteristics of the SARS virus for children presenting that come to hospitals. So in terms of research, has the research been promising? We seem to be have lost Professor momentarily. Let me just check. Professor?
Hi there, I'm still here.
Okay, we don't see you on the camera, but we can hear you. That's fine. So, Professor, as I was saying, in terms of research, has any has there any new research or that come to the fore with regard to COVID-19 in children under
Yes.
19 years old?
So that's what I was commenting on earlier when I said 400 children out of 60,000 adults that have died, 400 have died only. So children are not admitted nearly to the same extent. We're looking at 1% of the adult population. So very, very few. And those are the research, those are the studies and the numbers from South African studies. So very much fewer children are being admitted, and it's happening throughout the country. As pediatricians, we are in touch with our colleagues throughout the country. And so children may be admitted with COVID incidentally, as I said, broken arms, trauma. But on the whole, if your child is well and doesn't have any major comorbid morbidities like cancer or prematurity or heart disease, on the whole, the children will not be sick enough to need admission to hospital. As I've explained, our own children's hospital does not have a single case at the moment.
Professor, has research pointed out the reason or maybe an antibody that presents himself in younger children that sort of, I don't know, if
Protects them.
it's
Yeah.
yes, I want to know, like, what is it that we probably could use, because maybe therein lies the answer in terms of protection for adults, especially our senior citizens. So what is it in our biological makeup or physiological makeup of children that provides us with this protection?
So firstly, children are generally healthy. If you look at the adults that are getting into trouble, they generally have comorbid morbidities like diabetes and hypertension. Children do not have this. So they have an immune system that's really strong, and they don't have other conditions that make them more predisposed to infection. So that's the one thing. The other thing is we also think they don't have the same number of receptors that adults do in order for this virus to bind to the receptors to make people sick. So on the whole, children are healthier, and this is a virus that is going to affect the older generation, and specifically those that have other illnesses at the same time. The average child is completely well. They don't have diabetes, hypertension, or any other problems like that. And I know one of your questions earlier was, should children be vaccinated? I'm going to answer that by saying everybody should be vaccinated, but if you have an at-risk group, which is the adults, as in the rest of the world, definitely vaccinate your adults and your at-risk patients before you vaccinate children, because children are not really being admitted to hospital. Adults are, they're being admitted, and sadly, a lot of them are dying during those admissions because of their illnesses. And so let's get everybody vaccinated. I know there's still so much vaccine hesitancy. I'm absolutely amazed at what false beliefs people have. It's just a vaccine. It's not that clever or that sophisticated that it can change your DNA or put a 5G chip in. But I think if all the adults who are at risk can get themselves vaccinated, they will prevent themselves from spreading this to smaller children as well. And in that way, we can get the whole community to try and fight this virus. Vaccinating children who are not at risk of being admitted instead of adults who are at risk doesn't seem to be a very logical approach, does it?
Yes, and so vaccines are recommended. So far, I'm seeing from Health Organization a position. It's recommended for 12 years upwards. Are there now trials being conducted for the, let's say, from birth to 12 years in terms of the safety of the vaccine? I'm thinking of children with comorbidity or children who have leukemia, and probably, I mean, you're in a renal unit, so children who have those comorbidities in terms of the safety of a vaccine for under 12s?
Yeah, so I think the safety, there's definitely trials happening across the world in this, and I think the feeling is that this is a safe vaccine for any age. We'll definitely need to get the numbers to definitely prove it in children, but as in the flu vaccine, if you think about it, you as a family all may get the normal flu vaccine. You happily vaccinate your children against measles and chickenpox, so these vaccines on the whole are pretty safe. But what we're saying is if you've only got a limited resource, the last thing you want to do is be using this vaccine for healthy children who have no risk of being admitted to hospital compared to older adults who are seriously at risk, or for the very small number of children who've got comorbidities. So if you think leukemia or kidney disease, end-stage kidney failure, those numbers are minusculely small compared to the number of healthy children running around. So I think we will get to a point where this vaccine is probably going to be something we're going to be giving everybody on a yearly basis. But it's a bit like a pot of gold. If you've got a very special pot of gold, you want to give it to the people who are going to benefit most. And that at this stage has got to be our older population, our healthcare workers, our frontline workers, the teachers, people in the shops, any people in service deliveries, that actually we can keep them safe and they can then stop spreading this disease to children.
Thank you, Professor, for your time and your insights. And yes, please heed the call of the Professor. And I think let's stay safe. And please remember, mask not below your nose or underneath. Remember, Professor says we breathe out from our nose. So please wear your mask properly. Cover both the nose and the mouth. Thank you,
And
Professor.
get yourselves vaccinated.
And let as well. Professor, thank you. And may you be under the mercy and the protection of the Almighty, and stay safe.
Thank you very much. Bye-bye.
Bye. That was Professor Mignon, and she's the head of the clinical unit at the Red Cross Children's Hospital, as well as the president of the Pediatric Association of South Africa. Yes, so good news indeed in terms of children and the risk factor in a healthy child. Let's say your health is your wealth. So a healthy child is a wealthy child, and we pray all our children are blessed with immense health and wealth. Let's take a short break.